Hello, my name is Jhenyfer. I am a student in the Radiologic Technology program at the Federal University of Technology, Projeto. In this video, I will talk about a disease called filariasis, which is the topic chosen by me and Maria Eduarda. She introduced the anatomy of the lymphatic system, and I am here to discuss this disease that directly affects the lymphatic system. Here is the outline I will cover in this video. I will talk about what lymphatic filariasis is, the locations most susceptible to developing this disease, the causative agents, transmission and life cycle, symptoms and diagnosis, treatment and prevention, and which doctor to consult if someone suspects they have filariasis. What is filariasis? Lymphatic filariasis, elephantiasis, is a chronic parasitic disease and is considered one of the leading global causes of permanent or long-term disabilities. It is recognized as a tropical disease, meaning it is typical of tropical and subtropical regions of the planet. Approximately 51 million people were infected in 2018, and 40 million were disfigured by the disease. In 2000, the World Health Organization launched its global program to eliminate lymphatic filariasis. As a result, substantial progress has been made in halting the spread of infection through large-scale annual treatment of eligible individuals in areas where the infection is present. By 2020, more than 860 million people lived in areas with sufficient infection levels to require annual treatment. Locations most susceptible to developing filariasis. In Brazil, the epidemiological profile of this disease was established in the 1950s when blood smear surveys were conducted nationwide. Based on the results of these surveys, outbreaks were identified, and priority areas for intervention were designated. These areas, a total of 11 cities across 6 states, were then considered a filariasis hotspots in the country. Since then, a series of actions have been implemented to combat this endemic disease. These actions aimed to reduce infection primarily by eliminating human sources of infection. Thousands of blood smear exams were performed annually on residents in endemic areas. Subsequently, individual or collective treatments were administered depending on the epidemiological situation of the location, leading to the successful elimination of the disease in most parts of the country. After years of efforts, this disease is now in the elimination phase in Brazil. The endemic area is currently restricted to the metropolitan region of Recife, with 2017 being the last year a confirmed case was identified. Causative agents, transmission, and life cycle. Filariasis is caused by the nematode worm Wuchereria bancrofti and is transmitted through the bite of an infected mosquito, Culex quinquefasciates, commonly known as a mosquito or gnat, carrying the parasite's larvae. After penetrating the skin through the mosquito bite, the infectious larvae migrate to the lymph nodes, where they develop into adult worms. If both male and female parasites are present, they reproduce, releasing a large number of microfilaria into the bloodstream, which can infect new mosquitoes and start a new transmission cycle. Symptoms and diagnosis. The symptoms of filariasis appear when there is a significant number of circulating parasites. Symptoms may take up to 12 months to appear, and individuals can remain asymptomatic during this period. As the parasite develops and spreads throughout the body, it triggers inflammatory reactions and may obstruct lymphatic vessels in some organs, causing the characteristic swelling of the disease. The most important clinical manifestations of lymphatic filariasis include edema, abnormal fluid accumulation, in the limbs, breasts, and scrotal sac, which can lead to disability. Other symptoms include swelling of the testicles, hydrocele, fever, headache, chills, swollen lymph nodes, especially in the groin area. The diagnosis of lymphatic filariasis, elephantiasis, must be specific and detailed to rule out other diseases. Laboratory tests that confirm the presence of the parasitic worm causing the disease include Direct examination on slides. Positive blood smear. Ultrasound, which can demonstrate the presence of filariae in the lymphatic vessels. Other tests, particularly card-based ones, can be used for screening. Treatment and prevention. The prevention of filariasis involves measures to avoid mosquito bites. The best way to prevent filariasis is to stop its transmission. It is recommended to avoid stagnant water and garbage accumulation, which helps reduce the number of mosquitoes in the environment. Additionally, contact with the mosquito vector can be avoided through the use of mosquito nets and repellents, installing screens on doors and windows, and avoiding prolonged exposure in risk areas. Treating infected individuals is also essential to prevent new transmissions and interrupt the disease's cycle. Lymphatic filariasis is typically treated with diethylcarbamazine, taken orally for 1 to 12 days. This medication kills microfilaria and some adult worms. Before administering diethylcarbamazine, doctors check for other infections, such as loiasis and onchocerciasis, as this drug may cause severe side effects in individuals with these conditions. When discovered early, filariasis is curable, and treatment involves using medications prescribed by a doctor. The drug destroys most microfilaria present in the blood. In more advanced cases, the disease is incurable. However, treatment is crucial to prevent the proliferation of worms and resulting swelling and deformities. In Brazil, treatment for filariasis is free and provided through the Unified Health System, SUS. The treatment is long-term and should not be interrupted. Which doctor to consult? If you suspect filariasis, it is advisable to consult a doctor specializing in infectious diseases or a dermatologist. They have the necessary expertise to diagnose and treat the condition, including evaluating specific tests to confirm filarial infection. Here are the references used in the research, and here are the references for the photos included in the slide. That's it. Thank you very much.